Good morning, dear students. Today I'm going to explain for you Unit 6 in Real Speaking and Listening. And the title of this unit is Have You Got a Headache? Due to technical problems that you may face and I may face as well in terms of uploading to the channel or into the Google Classroom, I'm going to focus on the most important points and to explain that for you briefly. So here we go. Here it is. We do have we need to listen and to speak. How are these people feeling? Match the pictures to the expressions. We need to make the match between these pictures and these expressions. We usually, when we have a health problems as a patient, we usually say these words. I think I've got the flu. I've got a terrible toothache, or these kind of expressions. For example, I've got a terrible, as I said, headache, or my throat is really sore. I can't stop sneezing. I've got a temperature. I have, for example, a bad cough, or I've got a sore eyes. I've got a swollen knee. These expressions we usually use when we go, for example, into the clinic, into the private clinic, or into a public hospital, and to tell the doctor or the chemist or anyone concerned with giving medications. Okay, so here we need to make a match between these characters, okay, and these words and these expressions, these sentences. So we have got the answer for this sentence. I've got a terrible headache. This is a D. While the second one, we have it for my throat is really sore. And the second one, get F. And here we go. We have this one, this picture. While the third one, I can't stop sneezing. This goes for A. This goes for A. This one. Okay. The next one, I've got a temperature. This goes for B. Yeah. While we have point 5, I have got a bad cough. 5, bad cough. This is for what? For C. Yeah. And then the next one, I've got a sore eyes into the E. Yeah. And the last one, I've got a swollen knee. This is for G. This one. Okay. So we have helped you in order to show you the match. I mean that how these pictures can represent these words. Okay. What we have when we have an illness, or when we suffer from any health problems, we usually tell about the symptoms that we, for example, that we have. For example, to tell the doctor about, or the chemist, yeah, about these symptoms, okay, to provide us with the most appropriate drug or medicine, okay. Here we need. By the way, I have attached for you in this class the PDF. I mean that the whole unit, in order to help you by every single point, and as well with the audio and with the audio scripts as well for every single item in here. Yeah. So you need to study it thoroughly and completely. Here we have a conversation. Let's listen to
Recording 43.
Hello. Hi. I think I've got the flu. Could you give me something for it? Okay. What are your symptoms? Well, have you got a headache, sore throat, temperature? Are you coughing? Yeah, I can't stop coughing at night. Okay. How long have you had the cough? Oh, a couple of days now. And I have a headache too. Do you take any other medicine?
No.
Okay. This is cough mixture. It will stop the cough. The most important thing is take 2 spoonfuls 3 or 4 times a day. Don't take it just when you've got a cough, because then it takes a little while to work. You need to take it before you cough. Or if you don't want to take medicine, then there is a lozenge you can have. Take 2. Have one, and then as soon as you finish, take another one. One after the other.
Can I take both the lozenges and a cough mixture?
No. You must take one or the other. You can have the cough mixture at night time and carry the lozenges in your bag during the day. If you're going to the movies and you think that cough's going to annoy people, you can have some lozenges. They soothe your throat, because sometimes if your throat's dry, you cough, so that will help there.
And what about my headache?
You should take paracetamol for your headache. It's gentle on the stomach and it's safe to take. And take 2 of those every 4 hours. Maximum of 8 in 24 hours. You mustn't take more than that.
Okay. And what about my eyes? They're really sore. Is there anything I can take for them?
Yes, try these eye drops. Squeeze 1 or 2 drops into each eye twice a day.
Okay. And how long do I take this medicine for?
About 10 days. You shouldn't take it for longer than that. Okay, and remember to take multivitamins too.
Okay, thank you for listening. Here we have the conversation between the patient and the pharmacist. Bear in mind that in the British English, they call it a pharmacy or a chemist or pharmacist in chemist, while in the American English, they call it a drugstore. So we need to differentiate between the pharmacy and the drugstore. Pharmacy is in the UK, while drugstore is in the US. Okay, so here it is a little difference between the two. Again, we need to you don't need to follow up firstly. I mean that initially you need to listen to that conversation once or twice at least before you go into the audio script and to follow that, simply in order to draw the attention and to know how the words have been stressed and how the rise and fall have been showed by the by the speakers. Okay. Next, we need to answer this question. Listen to the conversation. What symptoms does she have? So at least we've got these symptoms. So it means that we need to listen to the conversation again. But simply, it's clear that Chu Ho suffers from, or she has, a cough, a headache, and a sore throat. Sore eyes. Okay. So cough, headache, and sore eyes. Right. The first one, as I said, a cough, headache, and B, headache, and C, sore eyes. Again, look at these instructions for different medicines. Listen again and complete the gaps. It means that we need to listen to that and then to fill in up these blanks. Okay. So if you notice here that we have it for A, directions for use. All right. Adults take 2 spoonfuls 3 or 4 times a day. The first one has been answered. Okay, we need to go into letter B. Yeah, this is for the cough mixture. Well, the cough lozenges. Yeah, the cough lozenges. Here we have directions for use. Take 2, 1 lozenge at a time. C. This is for the tablets or pills of paracetamol. Yeah, adults take what? Take 2 again. Take 2 tablets every 24 hours. Don't take more than that. Okay, more than. For E, we have 8 tablets. Don't take more than 8 tablets in 24 hours. And then we have for the letter F, okay, these are eye drops, okay, if you notice that. Directions for use, yeah, for adults only. Squeeze 1 or 2 drops into each into each eye, into each eye, twice a day. So we need to what to fill in up these blanks with the suitable, that with the correct words, and this we can do when we listen at least once or twice for that conversation between Chu Ho and the chemist. Okay.